Hi there, I'm Don Hansler, an independent voter. I worked in the field of public education for 53 years. During my career, I witnessed numerous debates on a variety of societal issues. During the last 2 years, three of the most frequently discussed issues have been healthcare reform, tax reform, and reduction in poverty. In regard to reducing poverty, an effective policy would be to provide every legal law-abiding citizen over the age of 17 who had less than $12,000 personal income the previous year a guaranteed minimum income, or GMI. The amount of the monthly GMI payment would be derived from the poverty level, which is currently about $24,000 per year for a family of four. Using that figure, each qualifying member of the family would receive a monthly GMI payment of $1,000. However, the amount of each individual's monthly GMI payment would be based on a sliding scale depending on his or her gross annual income on the previous year's tax return. Each individual over 17 years of age would be required to file a separate tax return from the other members of their family. In order to qualify for the GMI payment, the recipient would have to participate in some kind of job training or community service. Another issue that should be considered is the need for healthcare reform. Currently, the average annual cost of private healthcare insurance for a family of four that covers medical, dental, vision, and prescription drugs is about $12,000 per year. Under my plan, every individual of any age would receive a health care voucher for $3,000 per year. The vouchers could be redeemed only by government-approved health insurance companies. Each individual and/or family could pool their vouchers in order to negotiate for favorable insurance rates. Under this approach, the cost of health insurance would be controlled by market forces. One of the most likely objections to the GMI plan and the health care voucher plan would be that they would cost too much. However, that cost would be offset by the fact that this plan would permit the elimination of the Social Security, Medicare, Medicaid, food stamp, and welfare programs. The government currently spends about $1.6 trillion on those programs. The cost of the GMI and healthcare vouchers plan would be about $1.5 trillion per year. So there'd be a savings of approximately $100 billion per year. Individuals who had paid into the Social Security Fund prior to the start of the GMI plan would be grandfathered in by allowing them to receive Social Security payments at age 62 up and until their individual Social Security funds were exhausted. In order for my economic plan to succeed, it would be necessary for the government to adopt a tax policy that is less complicated and more equitable than our current policy. A tax that would be equitable and yet not discourage free enterprise would be a flat tax on all personal income only, with no exemptions or deductions except that the first $20,000 of each individual's income would not be taxed. Under this plan, income taxes on business profits would not have to be paid until those profits became distributed as individuals' personal income. Thank you for viewing this message. If you feel that the approach that I'm recommending is logical, please urge your members of Congress to view it. If you have any questions or concerns about what I'm proposing, you may call me at 253-219-3137. Thank you.